Hi, Filippa. Thank you so much for joining me today.
Thank you, Risa. I'm so happy to be here.
You're here all the way from Sweden, which is very exciting. I'm so glad that we connected because you're talking about global women's health issues, something that we are all dealing with, and a lot of us are not talking about enough. And so I'm so happy to see that you're creating a platform for women to discover and explore and hopefully, really treat themselves and be able to heal themselves on many of these issues. So while we kick this off, if you can tell me a little bit about yourself and your background and how you even came to finding, and establishing women's cycles.
I have been working with health almost all my life, and especially around yoga and things connected to yoga. So around 13 years ago, I started an organization here in Sweden that implements yoga into schools. So we educate the teachers to integrate exercises 5 minutes every day to integrate in the classroom.
Oh, that's amazing.
Yes, yeah, it's been an amazing journey. I've learned so much. And then 5 years ago, I gave birth to my first kid, and I had birth injuries, and that's when my, career took a turn, and I became so much more interested in women's health issues because I realized that not only with birth injuries, but there are so many issues that women have to face, and they don't get enough support. Maybe it's the same for men, but actually even more so for women.
Yeah, I think we're much more complicated beings.
Yeah, definitely. Much more complicated. I mean, we have throughout most of the years of our lives, we have hormones that dominant, and it's different hormones every week or every fourth week. So yeah, definitely much more complicated. And actually, the majority of the research done within the healthcare system or the medical system is done on male subjects, and then they just apply that on women's bodies, which,
Why? Why?
yeah, it doesn't work. I mean, it's completely wrong, actually.
Right. It makes no sense. Um, that's stunning to me. But I mean, also does not shock me at all either. Uh, so how did you then want to dedicate your life to creating a platform to help other women?
Yeah, it was an interesting journey. I had birth injuries, as I mentioned, after my first son.
What
And
kind of birth injuries?
yeah, so actually, after I gave birth to him, they told me, "Oh, you don't have a scratch, like you don't have anything here." But I felt something was wrong already at that point. And then, 6 weeks went past, and I still felt something was off. So at the checkup, I asked them what's wrong.
You felt something physical or was it
Yeah,
hormonally?
yeah, both. So I would say physically, I felt less connection than I was used to, and I've always been used to have a strong connection to my pelvic floor. In yoga, you do a lot of exercises, with the pelvic floor, and I couldn't do them. I didn't feel any connection. So that was one thing, and also air was coming in, so vaginal gas it's called, when the air comes in and then comes out, like it's so loud and so much air coming out, so it's very embarrassing, and also like you feel such a lack of control, and that affected me a lot mentally as well.
Oh, yeah.
Yeah,
Is this common?
it's quite common, yeah, but nobody
Wow.
talks about it.
Yeah. Nobody.
No.
I mean, it makes also sense, right? If you're having a vaginal birth, that's likely to happen if you have, but at the
Yeah.
same time, why isn't this kind of part of the whole, I don't know, birthing process where they're taking care of the women afterwards, right? Postnatal.
Exactly. And when I went back, actually, I think around 5 times over the course of a year, I went back to the healthcare system searching for help. But, and I was telling them my symptoms, that I didn't feel connection and gas or air was coming in. And they just told me that everything looks good, go home and do your Kegels. So unfortunately, this pacified me to search further. And that's so sad that, we believe in a way that the healthcare system is kind of the last and final destination. And if they can't support or help, you can't do anything. That's what happened to me. But then I gave birth to my second son and things became a lot worse. I had a symptomatic prolapse. And
What
that's
does that mean?
Yeah, that's when one of the pelvic organs is pulled down into the vaginal opening. So
Oh,
either the rectum, the uterus, or the bladder.
is that painful?
It can be very painful. I didn't experience pain. Many women do experience pain. For me, it was more, it's the sensation as if a tampon is falling out and you can't remove it. So I became so aware of this sensation. I didn't want to walk. I didn't want to move my body at all. It felt like I was going to fall apart at any second. And I understood that that won't happen, but mentally I was like in a freeze because
Yeah, of course. Yeah, no, if you feel like your insides are coming out of you, I mean, that's terrible.
that's
So,
horrible. I was depressed. I felt my life was over, and I had one baby and a 3-year-old. And you don't want to feel like your life is over when you have kids in that age, or you don't want to feel that ever.
right. So what did you do?
Yeah, so then I already knew that I'm not going to go back to the healthcare system. They didn't help me in the first place. And of course, I Googled, and the options like the Swedish WebMD that I was reading at when I searched, they suggested surgery. And I felt like it was just a no. My body said no to that. I don't want to do that. It feels too invasive. It doesn't feel like, is that really necessary? I have given birth. I haven't, been in a crazy accident, or it's kind of,
Right.
I have a belief that women's bodies, it's a natural thing to give birth. And I really believe in the body's capacity to heal.
Right. If given the
So
proper tools and the proper environment to be able to do that, right? Yeah.
exactly, yeah. So that wasn't for me. So then I started to, search on Google. And after a couple of weeks, I started to find women who had healed their prolapses naturally. So that was such a mind shift for me. I felt hope, I felt meaning. Nothing had changed in my prolapse or my physical body, but my whole life changed in that moment because I knew I wasn't stuck in this. So then I tried all the methods that they talked about. I did courses. I spent all my time and energy doing the research and learning the methods and trying to navigate online, also to, on YouTube and podcasts and different websites that these women had their courses on. And it was very,
Specifically on prolapse, to heal prolapse.
yes. So
Wow.
that was really the main thing. It took about a year, and after a year, I didn't have the symptoms anymore of the prolapse.
Wow. So are these like certain kinds of, I don't know, exercises types of things, or are you actually taking supplements? Or
Yeah, it's both, I would say, on a physical, so exercise, diet, supplements. It's also emotional processing, and for me, spiritual. So I think if you want to heal naturally, you need to work holistically.
mm,
So I think you need approaches for all of them, and not one thing will, work for everybody. That's also a trickier thing than if you go to a doctor, you just get a medicine, or you get a surgery and then you're done. But you need to start to listen to your own body, your own needs, and see all the different methods that are out there and pick the ones that you think your body will respond to.
and so now you're symptom free?
Yeah, I'm symptom free. I'm still working on like the injuries now that I had after my first kid, because now I'm like, I know I can heal. Why should I stop? I'm gonna heal completely. So that's my aim now, and I think it's gonna take some more time because it's already been a few years since that happened. So I'm on a journey, and it's really exciting and it's so hard sometimes.
Oh, of course. And I think that healing naturally takes also the patience and creating lifestyle habits to create an environment that's going to foster that, right? Foster that healing. But that's so great because if you have those small successes, you just want to keep going, right? And nurturing your body and taking care of it, which is a good thing, right?
Yeah, yeah, exactly. I'm kind of like, why didn't I know all of this a long time ago? Then, probably I could have prevent that it ever happened. So, but
Right.
but yeah, I'm so happy I get to learn to get to know my body now and know all the methods and what makes me feel good.
So you actually created your own course, right, on prolapse.
Yeah,
And
or yes or no. I did some trainings in some of the methods that I used. For example, hypopressives, which is a breathing technique that also activates the pelvic floor. It's an amazing. It's like a meditation almost. So you do different postures and you activate the fascia in the body. So the fascia is like a web throughout the body. The skin is a part of the fascia. It's all the tissues in the body. So it's the biggest organ actually in the body. And you you need to work holistically with fascia. You can, for Kegels, for example, it's very isolated. It's very like you only work with a few muscles in the pelvic floor. But when you work with hypopressives and you do this specific breathing technique, you activate the whole pelvic floor and the slow muscle fibers in the pelvic floor and also the nerve endings, so that the
oh,
nervous
wow.
system starts to work again and understand different situations you are in. So if you're having incontinence, for example, the pelvic floor can start to respond to, okay, now I can't pee now, like I need to go to the toilet first and then. So that's amazing. And I did that training. I became a trainer, and then Sweden is not such a big country, so the word like spread very fast that I had so much improvement in my prolapse from doing hypopressives. So suddenly I had like hundreds of women in a queue who wanted to do hypopressives with me.
Wow.
And it was at that time that then me and my husband were speaking, and he's a tech entrepreneur. He's built many tech companies in his life, and he saw like the pieces of the puzzle easier than I did. He was like, okay, you have so many women here, you can't help them all. I mean, having one-on-one sessions is not effective enough. And at the same time, your journey was really tough because I spent so much time searching and finding and paying lots of money to all the different methods I learned and all of that. So he said, why don't we see if we can aggregate all knowledge on a platform and create courses and take all of these women who have been through different challenges, come out on the other side, and are now helping women to heal or improve whatever issue they are facing.
Wow. And so that's women's cycles.
Yes, that's women's cycles. And I don't have a course yet on women's cycles because I want to heal completely first. But we have, there are so many women who have done amazing things. And we have many, many creators already that have courses.
So what are some of the topics that you cover in women's cycles?
So our aim is to cover everything from before puberty to after menopause. We are not there yet. We have listed 4,000 plus symptoms and diagnoses that women can face that we want to
What?
have courses around. Yeah.
What?
Yeah.
4,000?
Yeah.
Wow.
We want to have everything, like the small, even if it's only like 6% of all women facing something. We want to have a course on that because those women will need help. So we really want to aggregate everything. At the moment, since we launched in February, it's like a little more than 3 months, we have 20 courses now. So it's a start. We are aiming to have hundreds of courses by the end of the year. But it's been actually a lot around pelvic health, mainly because I asked my teachers to join, and we started from there. But we also have some mental health issues and menopause and.
That's incredible. I mean, I feel like this is definitely a gap in the market. I feel like, there are gynecologists, of course, who study women's health all their lives, but most Western doctors, I feel like, are trained in a very specific way. Um, and there are a lot of smaller ailments that cause a lot of distress in one's life, that are not talked about at all for whether there's shame involved or I mean, we don't even talk about menopause. I mean, it's crazy, right?
We don't even talk about periods.
I know.
Like, and when a girl gets her period, it's like she gets a pad, and then
I
no one
know.
says
Good
anything.
luck to you.
And it's so crazy because that's the reason we exist.
Right.
Like, I think it's so interesting how human beings think, because that's shameful, our periods and everything around women's health, and vaginas or vulvas or pelvic issues, everything is so tabooed, but like that's where we all came from.
Exactly.
It's yeah, it's
Yeah,
fascinating.
exactly. I mean, it should be revered, if anything, right? It should be.
Yeah, yeah,
Um,
it was in so many culture, it was, but nowadays, unfortunately, it's not.
yeah, no, it is unfortunate, but I'm so happy to see that you're bringing a light to this, and we're going to be partnering up, for this so that modern aging viewers can get a discount if they take any of the classes at Women's Cycles. Do you want to share a little bit about that?
If you use a code when you sign up on the platform, we have two different subscription plans. One is quarterly, and then you pay $13.99 per month. If you pay annually, it's $9.99 per month. So I think it's very affordable. And if you use the code MAWC in capital letters, you get 15% discount.
That's so awesome. I think it's worth it to try it, and then because you have new courses that are going to be, announced every month, right?
Every week now, actually.
What? Wow, that's awesome.
Yeah. And I hope that you will add your courses.
Of course, yes. No, I know we've been talking about developing a course together, and as soon as I get my act together, I'm definitely going to do that.
Yeah, I mean, you're amazing. You've healed many things, right?
Well, I've healed some things, and some things are a work in progress, but I still wholeheartedly believe in holistically allowing our bodies, to come to equilibrium and let our bodies heal. I don't think that we give our bodies credit for what it's capable of a lot of times. Um, and the more I dive into this whole field, it's just amazing, right? And I just want more people to know that there are options out there, that it's not only just a pill or surgery. You have so many other options.